Did you know? Hi, and welcome to Did You Knows? This week's episode is going to be dedicated to nasal dilators. Nasal dilators work to improve our nasal breathing through opening of what we call the nasal valve. That is the front part of our nasal airway, just inside of our nostril opening. So as you look inside of your nose or feel inside your nose, what you're going to feel in the middle is your septum. On the side, we call our lateral or side wall of our nose, and then straight back is going to be our turbinate. You can think of that as a tripod where if you affect any of those three areas, you can actually see an improvement in your nasal breathing. One easy way to see if you have a problem in your nasal valve is by simply pulling the side of your cheek to pull your nostril open. Take a breath and see if that helps you to breathe better. If it does, then you have nasal valve stenosis, or if you breathe in and your nose collapses, then you have nasal valve collapse. So one of the ways that we will help to fix this problem is by using nasal dilators. Those can come in the form of something like this, a little circle that simply goes inside of our nose and fits just like this to help push the nasal sidewall away from the septum. This works a little bit more effectively than something like a breathe right strip, which would go over the outside part of the nose trying to pull the nostrils apart. Once this has been relieved, many of us will experience an improvement in our nasal breathing, and then you have the option. You can use something like this to help with improving your nasal breathing, or you can consider procedures that could help to decrease your dependence on something like this and open up your nasal valve. Often when patients are suffering from headaches or facial pain or neck pain, I'll recommend using these for about 12 hours a day, alternating between daytime and nighttime to see if either one of those times are more beneficial for them. Again, if you have any comments or questions, please leave those in the comments below. Thank you for watching this episode of Did You Knows, and I'll see you next week. Did you know?